Hello, everyone. If you can hear me, please type it in the chat box. Can everyone hear my voice? Great, thank you, Esther. Thank you for attending our active employee and non-Medicare retiree general medical plan overview webinar. We'll start with a pre-recorded video overview. Your microphones will be muted during the presentation, but feel free to type in any media questions you have. Our representatives are here to help. And after the presentation, you'll be able to hear your questions answered by our representatives. And with that, let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Well, good afternoon, everyone. Thank you for joining us today for this webinar to kick off your 2025 open enrollment. As you may know, this is now the 4th year our Health and Canopy Care HMO plan is being offered, and we're excited that you've joined this webinar to learn more about the plan and all the wonderful programs that come with it. But first, quick introductions on the speakers. My name is Fred Reyes, and I'm representing HealthNet. And with me today, I have Emma Welch, who's representing our Canopy Care HMO Medical Network. Next slide. So I'm going to hand the presentation over to Emma now to walk you through the partnership that was created between HealthNet and Canopy Care. So Emma, I'll turn it over to you.
Thank you. So Canopy Health is a network offered through the HealthNet Canopy Care HMO plan. So the Canopy Health Network offers an affordable pathway to some of the best healthcare systems in the Bay Area. It includes 5 medical groups. As you can see, John Muir Health Physicians, Skippa, Dignity Health, and Providence, as well as 30 hospitals and over 80 urgent care centers. As you can see on the map to the right, we span over all 10 Bay Area counties, so from Sonoma, Napa, all the way down through San Francisco to Santa Cruz County. For what's new this year, Canopy Care continues to be one of your most affordable options while still providing access to high quality healthcare. As far as our network, the UCSF and John Muir Health Cancer Center opened on the Walnut Creek campus this past February. It's a beautiful facility. And then the UCSF Bayfront location opened in San Francisco last month, so August. And then there are some new telehealth services that Fred will go over later in this presentation. So Canopy Health offers an alliance referral program, which allows you to go outside of your primary care network with a referral from your primary care physician. So this gives you access to the entire Canopy Health network to find a specialist that is right for you or to get a second opinion. So it offers a bit more flexibility. First, you'll meet with your primary care physician, and if deemed necessary, you and your doctor will discuss options within the network. Once that referral is sent and approved by the group's referral department, then you are free to schedule your own appointment. And then if you do have any questions specifically about the Alliance Referral Program, there is a dedicated email that's included on this slide, as you can see. So challiancereferrals@canopyhealth.com. And then I'll hand it back over to you, Fred.
Thank you, Emma. All right, so next we're going to talk about behavioral health solution that we offer our SFHSS members. So when it comes to access to care, we have you covered. We have over 20,000 in-network providers with over 5,000 of these providers that accept both in-person and virtual care, a 24/7 call center, and also integrated care management, which means that if you ever need higher level of care, both your primary care physician network and therapists would work together to provide you with some whole person care. Next slide, please. And so here's a quick glance at the benefits. Important thing to mention that no referral or authorization is needed for outpatient office visits. So as you'll see here, that's a $25 copayment for outpatient therapy. Higher level of care, again, inpatient care in a hospital, detoxification, that would require an authorization, and that's a $200 copay per admit. And then outpatient services, that's things such as alternate care, partial hospitalization, day treatment, inpatient physician visits. That also requires an authorization, but that's covered at 100%. So no cost share for members. Next slide. And so in the next couple of slides, we'll cover our wellness programs as well as our value-added programs, which are free or zero cost to our members. So next slide. So a couple of important items we want to cover first before we get into these programs. All the programs that we offer can be accessed online at www.healthnet.com/SFHSS, and members can register to access all the programs. So first up, we have our Real Age Test. This is a personal health risk assessment where you can earn up to a $50 gift card just for taking the test, and up to $50 more for completing some other online health activities. Next, as Emma mentioned, we offer teledoc virtual care at no cost to our members. And this is great when traveling or if your regular doctor is not available, you can talk to a healthcare provider over the phone or video. And sign-up information is listed here on the slide, but it could also be found on the website. And next, we have Wellbe, which is our decision support program that helps members decide on, prepare for, and recover from surgery. And members can also earn a $25 gift card just for completing a couple of the program modules. Next slide, please. And so when it comes to behavioral health wellness programs, we also have you covered there. We provide some great self-help tools and programs to help our members improve both their mental and physical health. So first up, we have My Strength, which provides in-the-moment mood tracking. It also provides instant stress relief actions that can help a member achieve lasting and healthy changes. And next, we have our Unwinding program, which uses mindfulness to help our members build resilience. Members are able to use it throughout the day whenever they find themselves feeling stressed or if they need a quick dose of calmness. And through the use of breathing exercises, meditation, sleep support, visual relaxation, and more, members can start living a less stressed life. Next slide, please. And in these next couple of slides, we'll go over what you can expect when changing plans. Next slide. So one of the most important things to keep in mind is that you will be automatically assigned to a primary care physician under our plan. However, you have up to 90 days to make a correction if needed. If your provider and or medical group under your current plan are also contracted with Health Net, all you need to do is just ensure that any authorized services taking place in the new year are either submitted to Health Net or updated by your medical group. Members will be eligible for continuity of care. So this means in certain circumstances, you may be able to continue care with your prior health plan provider. And last point we want to call out is it's non-urgent appointments can be very hard to come between the period of January and March. So therefore, it's always a good idea to schedule an appointment and confirm availability of your doctor as soon as you can. Next slide. And some pharmacy program basics. Again, we strongly encourage all of our members to get familiar with the new formulary, identify prior authorization requirements, any cost differences there may be. Also note that any prescription authorizations or clinical criteria notes do not get transferred to the new health plan. So if you did go through that process with the previous health plan, in order for that to be a smooth transition and avoid any issues, we always recommend that you try and complete Health Net's prescription transition forms located under our website. And that applies to prescriptions as well as self-injectables. And that'll allow the authorization under your previous health plan to carry over to the Health Net plan. And next up, one final important thing to remind you about is our open enrollment office hours. This is the opportunity for you to schedule an appointment and talk to one of our customer service agents about any questions or concerns that you have about the plan, or if you're considering making a switch. Next slide, please. So as we close, we just want to summarize on why someone would want to consider choosing Canopy. And again, we provide affordable access to some of the best hospitals and medical groups in the Bay Area. Easier access to specialists through Canopy Health's Alliance Referral Program. Canopy is a network of choice for many doctors, nurses, and their families all around the Bay Area. And finally, Health Net's whole health member-centric programs and services that support our members' physical, behavioral, and emotional well-being. So this concludes our presentation. We just want to say thank you for your time today, and we hope you found this presentation helpful, and we wish you good health in 2025. Thank you.
Good afternoon, and thank you for joining today. My name is Adam Gunther, and I am a Senior Account Service Representative here at Blue Shield of California. In this presentation, I will be going over, at a high level, the Access Plus, Trio, and PPO plans. I'll also be going over some differences between the three plans and the additional programs available to HSS members in 2025. What's new for 2024 open enrollment? For the Access Plus and Trio HMO plans, as well as the PPO plan, there are no medical plan changes for 2025. The benefits you have for 2024 will be the same benefits you'll have for 2025. All three plans will have a new and improved pharmacy experience, which will require new ID cards. On the PPO plan, HSS has chosen to add Blue Shield Connect. This will replace the services you may have previously received from Accolade. And all PPO members will be assigned a new group number and a new member ID. Now let's take a quick look at the Access Plus and Trio HMO plans. SFHSS members have the option between two HMO plans, the Access Plus or the Trio plan. The Access Plus plan and Trio plan benefits remain the same from 2024 to 2025. Both are HMO plans which require you to choose a personal care physician or PCP. These PCPs are associated with an Independent Physician Association or IPA, or are often referred to as medical groups. Members must stay within their chosen IPA for all services. Both Access Plus and Trio plans are copay driven. The benefits for both the Access Plus and Trio plans are the same, with the network being the main difference between the two. The Trio network is a subset of the Access Plus network and is only available in select regions of California, whereas the Access Plus network is Blue Shield's full HMO network and is available throughout California. There are no deductibles, only fixed co-payments for most services like doctor's visits, urgent care, and emergency care. Both plans have access to virtual care with Teladoc. There are mental health benefits to help with depression, mental illness, and alcohol and substance use disorder. Convenient access to extensive pharmacy networks, including Safeway, Vons, Costco, and CVS. And personal assistance from Shield Concierge, our team of healthcare experts to find doctors, transfer medical records and prescriptions, and answer any healthcare questions you might have. Taking a high-level look at the benefits for the Access Plus and Trio plans, you'll see the benefits are the same. As I advised on the previous slide, the benefits are the same for both plans, with the network being the main difference between the two. Both have no deductible with an out-of-pocket max of $2,000 individual and $4,000 family. Both have a $25 copay for PCP visits, a $30 copay for specialist visits, with lab work and teledoc at a $0 copay. Outpatient surgery in a hospital is $100 per surgery, and inpatient hospitalization is $200 per admission. Both have a chiropractic and acupuncture benefit at $15 copay per visit, up to 30 visits per member per plan year each. There is no pharmacy deductible for either plan, with retail drug copayments of $10 per generic, $25 for formulary brand, and $50 for non-formulary brand. Programs only available to the Access Plus and Trio members include Shield Support Care Management Programs, which provide nurse support, home visits, self-management tools, and workshops to help members with behavioral health, cancer, catastrophic injury, chronic conditions, LGBTQ health needs, musculoskeletal conditions and pain management, stroke, and the transplant process. For additional information, you can go to blueshieldca.com/shield support. Nurse Help 24/7 offers immediate answers to your healthcare questions. The lines are manned by registered nurses who are available 24 hours a day to answer any of your healthcare questions, including concerns about symptoms you are experiencing, minor illnesses and injuries, chronic conditions, medical tests and medications, and preventive care. For more information on this program, you can go to blueshieldca.com/nursehelp. The Away from Home Care program offers students, long-term travelers, and family members living apart access to health care from Blue Shield and Blue Cross plans across the country. The Away from Home Care program is available in 29 states and the District of Columbia, but availability varies by county within each state. Members using Away from Home Care services outside of California will receive the benefits offered by the host plan in the state they are visiting. To learn more about this program or to speak to a customer service representative, please call 800-622-9402. Now let's chat about a couple of exclusive programs that are available to Trio members only. The first is a non-emergency transportation service for members recovering from a serious illness. It offers reliable transportation to and from medical appointments. Eligibility is determined by a Blue Shield case manager. The second is a free meal delivery service which offers convenient and nutritious meals during recovery from a serious illness. These meals are prepared and geared towards special dietary requirements. Eligibility and meal service delivery frequency is determined by a Blue Shield case manager. For information on either program, you can call the Shield Concierge team at 855-747-5800. Now let's take a look at the PPO plan. SFHSS members have the option of selecting the Blue Shield of California PPO plan. The PPO plan benefits remain the same from 2024 to 2025. The PPO plan utilizes the Blue Shield of California PPO network. You do, however, have the option of using an out-of-network provider for a higher cost share. This allows you the option to see any doctor of your choosing, both in and out of Blue Shield's network. Members may self-refer. There's no need to see your primary care physician first. Members have access to virtual health care via teledoc. Members have coverage for medical care across the United States for urgent and emergency care anywhere in the world. And newly added effective 2025 is Blue Shield Connect, which includes access to customer service representatives and a dedicated care manager who are here to assist you with any questions you have, including help finding a doctor, finding treatment options, authorizations, setting health goals, and coordination of care. Taking a high-level look at the benefits for the PPO plan, you'll see the benefits remain the same from 2024 to 2025. The Blue Shield of California PPO plan is a co-insurance-based plan with a deductible which must be met before Blue Shield, as the plan, pays anything. The deductible for an individual is $250 and $750 for a family in-network, or $500 per individual and $1,500 for family out of network. PCP, specialists, outpatient surgery in a hospital, and inpatient hospitalization are all 15% in network after the deductible has been met, or 50% out of network after the deductible has been met. Chiropractic and acupuncture services are both 50% up to $1,000 max per member per calendar year after the deductible has been met. For prescriptions, retail copayments are $10 for Tier 1 drugs, which are mostly preferred generic drugs and some brand drugs, $25 for Tier 2 drugs, which is mostly preferred brand drugs and some generic drugs, $50 for Tier 3 drugs, which is non-preferred generic and non-preferred brand, and $50 for Tier 4 drugs, which are specialty and high-cost drugs. As previously discussed, HSS has chosen to replace Accolade with Blue Shield Connect. Connect puts a team of nurses, health coaches, social workers, and other specialists by your side. This includes a dedicated care manager to help you support you and find ways to manage your health, all at no additional cost. Connect to a healthier you. To get started, you just call 888-499-5532. Next, let's chat about an exclusive program available to PPO members only. Brightline is available to PPO members only and offers virtual coaching programs for children with licensed behavioral health professionals from 1.5 years to 18 years of age. There are no wait lists, video visits with expert therapists and coaches, programs proven to help work with kids and teens, and support for parents and caregivers too. For more information, you can go to hellobrightline.com/BlueShieldCA or by calling 888-224-7332. Next, let's talk about mental health benefits and resources available to all three plans. Mental health benefits and resources are available via digital programs such as Headspace and Headspace Care, which is formerly Ginger, via Wellvolution, virtual care via Teladoc, Nurse Help 24/7 and Life Referrals 24/7, and in-person care via the Magellan Network for Access Plus and Trio members and the Blue Shield of California Network for the PPO plan. For Access Plus and Trio members, Magellan is focused on recruiting specialty groups with innovative delivery methods to meet members' needs and improve healthcare. Such groups include Charlie Health, Growth Therapy, June, Equip, Talkiatry, Bicycle Health, Rhea Health, and Headlight. PPO members have behavioral health care options such as self-care digital programs and virtual care, which are Wellvolution, Credible Mind, Teladoc Mental Health, Life Referrals 24/7, and Nurse Help 24/7. They also offer the traditional network. Inside of California, members have access to Blue Shield's provider network of over 20,000 behavioral health clinicians and facilities. In-person and virtual options apply. And outside of California, members have access to over 34,000 behavioral health providers through the National Blue Card Network for in-person or virtual care options as well. Credible Mind is your virtual health resources hub. It offers articles, videos, podcasts, and newsletters. You can take a well-being assessment on a variety of topics, including stress, depression, anxiety, and more. You have access to crisis resources and hotlines. You can explore Blue Shield mental health services and programs, and you can find a mental health provider. To access, just go to blueshieldca.com/mental health. Now let's discuss pharmacy, the microsite, and additional programs available to all three plans. Blue Shield of California will be offering a new and improved pharmacy experience effective 1/1/2025. This new experience will offer a redesigned pharmacy hub, which makes it easy for members to manage prescriptions. It will also offer a side-by-side drug comparison, which will guide members to the lowest cost drug option. And it will offer notifications for members who have opted in to know when a lower cost drug option becomes available. Retail pharmacies will still include the major chains, including Safeway, Vons, Costco, and CVS. It will offer a 30-day supply and a 90-day supply of maintenance medications. Mail service will now be offered through Amazon Pharmacy and will include a 90-day supply for maintenance medications for the cost of only 2 30-day copayments. The specialty pharmacy for the 30-day supply for specialty medications will remain CVS. SFHSS members will also still have access to a microsite at blueshieldca.com/SFHSS, which will include an overview of Blue Shield plans, links to find network doctors, plan benefit documents, and details on programs and services. To find doctors, specialists, hospitals, and pharmacies, Access Plus members can go to blueshieldca.com/network HMO. Trio HMO plan members should go to blueshieldca.com/trio SFHSS. PPO members within California can go to blueshieldca.com/network PPO. And for PPO members outside of California, you will go to provider.bcbs.com. You will enter your location and you can browse a list of plans to find doctors that are in network in your area. SFHSS members can get 24/7 support for a low or $0 copayment from Teladoc. Teladoc Health doctors can treat many medical and mental health conditions, including cold and flu symptoms, allergies, respiratory infections, sinus problems, depression and anxiety, and grief and stress. To request a consult, you can visit blueshieldca.com/Teladoc or go on the Blue Shield mobile app. SFHSS members are also offered Maven, which provides virtual care support for if you are pregnant and up to 3 months postpartum. It offers on-demand virtual appointments with practitioners in more than 30 specialties, doulas, mental health specialists, and baby sleep specialists, care advocates to answer questions about your pregnancy, virtual maternity classes, support for pregnancy losses, resources to plan and prepare for a return to work after maternity leave, and support for family members. For information on this program, you can go to blueshieldca.com/maternity. SFHSS members have access to Life Referrals 24/7, which offers answers to simple questions like quick ways to de-stress or how to find more time in your schedule, to more difficult issues like finding support after the loss of a loved one. Life Referrals 24/7 is here for you. How it works is you can call Life Referrals 24/7 to speak with a specialist ready to assist you with your personal needs. Or you can visit Life Referrals 24/7 online for tools, articles, resources, and more. When SFHSS members are experiencing an illness or injury that is serious but not an emergency, consider visiting an urgent care center to receive care that is typically faster and costs less than an emergency room visit. To find an urgent care center, visit blueshieldca.com/FAD and select urgent care. All SFHSS members have access to transgender benefits, which follow the World Professional Association for Transgender Health's WPAP standards of care, which include providers who specialize in gender-affirming services, gender reassignment surgery, hormone therapy, mastectomy, breast reduction, breast augmentation, associated surgeries and services as agreed with the treating provider, such as facial reconstruction, chin augmentation, lip reduction or enhancement, etc. A case manager is assigned to help navigate the healthcare system. You can learn more by visiting blueshieldca.com/LGBTQIA-health or blueshieldca.com/gender-affirming-care. Lastly, let's talk about Wellvolution. Wellvolution is your online hub to find the right virtual health program to support you and your health goals. Whether you're trying to lose weight, stress less, or even just increase your longevity, there is something for everyone on Wellvolution. We offer programs around emotional well-being, diabetes prevention, diabetes care and hypertension, weight management, tobacco and vaping cessation, and physical therapy and fitness. Enrollment is easy, and customer service is available on the platform. How does it work? Well, number one, you create a Wellvolution account. You visit wellvolution.com to get started. They'll confirm that you're qualified to receive the program at no extra cost. Number two is you get your programs. Pick one or more health goals you'd like to work on, and they'll recommend the best programs for your needs. You can make your choice and get started. And number three, become a healthier you. With the assistance of your program, begin making healthier choices about diet, exercise, sleep, stress, and your overall health. And again, customer service is available on the Wellvolution platform via instant chat, email, and telephonic support at 1-866-671-9644. New to Wellvolution is the Blue Zones Challenge. The Blue Zones lifestyle is a healthy and sustainable way to lose weight. It's shown to reduce risk of chronic disease such as heart disease, stroke, cancer, and diabetes. Participants even report more energy, sleeping better, and feeling less stress. What's included is eat the Blue Zones way without dieting. Set up your surroundings to support you. Strengthen and build your social life, and reduce stress and boost happiness. Also new to Wellvolution is musculoskeletal health goal, fitness, and physical therapy. For low acuity, they offer general mobility via Sworkit. For medium acuity, it's a visual learner via Kia. And for high acuity, it's needs device coaching via Sword. Wellvolution also offers Virta Health Type 2 Diabetes Reversal Program. Virta Health is a digital clinical program designed to reverse type 2 diabetes substantially. Health risk requirements to enroll include type 2 diabetes and a BMI of 25 or more. The program is at no cost to members and includes physician-led care team, a daily one-on-one support from a dedicated health coach, personalized carbohydrate tolerance levels and diet plan, glucometer and diabetes testing and supplies, and a personal Fitbit. Also included in Wellvolution is Headspace. Headspace offers guided meditations, sleep casts, music playlists for focus, sleep, and dance breaks. The coaches are of diverse ethnicities and genders. It includes a library of 500 plus meditations on everything from stress, sleep, grief, resilience, to compassion, tension releasing workouts, relaxing yoga, focus music playlists, and more. Meditations are guided and can be 3 minutes to more than 20 minutes depending on what your need is and what you choose. Headspace is available in 5 languages, including Spanish, English, Portuguese, French, and German. Mental health is critical to your overall health. Headspace helps us look after our minds. Headspace Care is also included with Wellvolution. Headspace Care is an app-based and virtual care licensed medical provider. Behavioral health coaching offers members day-to-day support. The app includes a self-care library with interactive experiences that help members learn about and practice the valuable skills needed to manage stress, anxiety, and other day-to-day challenges via guided meditations, breathing exercises, recorded classes, and more. 80 to 85% of members have their needs entirely met by coaching. There is no copay for coaching services. Psychiatrists stand ready to support those in need of additional care, including prescribing medications. Health plan benefit designs dictate the member copays for virtual consults with clinicians. SFHSS has a $25 office visit copay for mental health. That copay applies for virtual consults with Headspace Care clinicians. Thank you for taking the time to attend this presentation. Should you have questions regarding this information or any other plan benefit items, you can always access this information at blueshieldca.com/SFHSS.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 3-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. We can help you get to your healthy place no matter where it is. We combine care and coverage, which makes us different than your healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you. Through our electronic health record, they can see your health history such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, and pick up prescriptions, all without leaving the building, making your care feel easier, faster, and centered around you. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Now let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. At Kaiser Permanente, your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our industry-leading preventive screening rates help your care team catch problems early. And if you mean specialty care, your team can connect you with specialists in one of the largest multi-specialty medical groups in the country. If you have a condition like diabetes or heart disease, you're automatically enrolled in a disease management program for personal coaching and support. Every contact with your care team is recorded on your electronic health record, which you and your doctors can access and review anytime, anywhere. This ensures that every caregiver you see has a full picture of your health, without you having to repeat your story. From virtual care, video, and phone visits to in-person appointments, you can choose how, when, and where to get care for you and your family. Plus, stay on top of your care 24/7 with the Kaiser Permanente app or at kp.org. If you prefer to visit in person, same day, next day, and weekend appointments are available at most locations, and many facilities have labs and pharmacies in the same building. Because your mental health and lifestyle are essential to your total health, Kaiser Permanente includes many resources for self-care at no extra cost. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Kaiser Permanente doctors have one priority: your health. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Your care team also uses your electronic health record to help you schedule checkups and tests. When you need care, you can talk to a clinician in person, over the phone, or by video. Same day, next day, and weekend appointments are available at most locations. You can also get advice 24/7 over the phone and online through an e-visit at no cost, saving you time and money. Telehealth services are not an add-on at Kaiser Permanente. They're covered at no additional cost by most plans and have been a part of how we deliver personalized care. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health record, so you never have to repeat your story. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions in person, over the phone, online, or on the Kaiser Permanente app. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Since keeping you safe and healthy is our priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics, located in select CVS and Target stores, the Little Clinic locations, or Concentra Urgent Care Centers when traveling outside a Kaiser Permanente area. If you seek urgent care at a Minute Clinic, the Little Clinic, or Concentra Urgent Care Center in a state where Kaiser Permanente is located but are outside one of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, there's the Away From Home travel line available 24 hours a day, 7 days a week. kp.org/travel is a special section of our website that's focused on getting care while traveling, and you'll have the ability to refill eligible prescriptions early in preparation for travel. When you're dealing with a serious health issue, your health becomes the center of your world. That's why you're at the center of everything we do at Kaiser Permanente. We're known for catching potential problems early with our robust preventative screening rates. If you do have a condition that needs more attention, you get excellent care from top-notch doctors across a wide range of specialties, including cancer care. Hearing that you have cancer can be overwhelming. But no member or doctor goes it alone. A multidisciplinary team of cancer specialists works with you and your family to determine the best approach to your treatment. Our experienced specialists combine earlier detection, cutting-edge research, and compassionate care. And we have access to groundbreaking clinical trials and other cancer research. We know that no two hearts are alike. There are many types of heart disease, and different people need different types of care. From initial diagnosis through treatment and into recovery, You and your doctor will make decisions about your care together, and you'll have guidance and support at every step. Through evidence-based treatments and comprehensive care and support, we help many members with heart disease live longer, healthier lives. In fact, Kaiser Permanente outpaces the nation in reducing deaths from heart disease and stroke. And our approach to prevention helps others avoid heart disease altogether. Personalized maternity care makes having your baby with us a unique and special experience for you and your growing family. Your dedicated prenatal care team will help keep you and your baby healthy and empower you to make decisions. You can add a midwife to your team too. Create a personalized birth plan of how you envision your day, and we'll help you have the safe and positive experience you want starting with your first appointment. You're cared for and supported at every step, from virtual and in-person tours of our private birthing suites to classes and online resources to help answer the many questions of expecting parents. Support doesn't stop at delivery. We offer breastfeeding consultation and other guidance to help your baby have a healthy start in life. Keep in mind classes vary by location, and some classes may require a fee. Your mind and body are connected. What you think, feel, and do affects your total health, and we are committed to caring for the whole you. We provide clinical and support services for a wide range of conditions, from stress and anxiety to drug dependence and autism spectrum disorders. Our mental health includes psychiatrists, psychologists, as well as family therapists, licensed clinical social workers, and addiction medicine physicians. And as a Kaiser Permanente member, you don't need a referral for mental health care. We also provide members with tools and resources to process self-care like guided meditation and wellness apps. Now let's see how we are using technology to give you more convenient ways to get care. Here are some of the wellness resources to help you stay healthy once you register at kp.org. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Join a program to help you lose weight, reduce stress, quit smoking, and more at no additional cost to members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Lastly, get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and, most importantly, see results. And you can do it all from the comfort of home. Partnering with a wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide, so it's easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and prescription seamlessly, and schedule your first appointment. If you still have questions, we are here to support you. Choosing a health plan is a big decision, but you don't have to make it alone. We're here to answer any of your questions so you can make an informed decision. If you have more questions, call the number listed on the screen.
Thank you. This completes our presentation. May you live well, be well, and thrive.
All right, everyone, that concludes our pre-recorded videos. And at this point, we're going to go ahead and invite everyone to the chat box. And if you have any new questions, please feel free to type them in. We have our representatives from Blue Shield, HealthNet Canopy Care, and Kaiser Permanente that has joined in with us. And you can hear them answer your questions, but you are still muted at this point. So if there are any new questions in the chat box, what I'll do is read off some of the questions from the beginning, so that way it can be recorded in this webinar video. And again, please think about your questions, and let's take advantage of this moment since our representatives are here. So for our representatives, if you don't mind re-answering some of the questions here so it can be recorded for prosperity. Let's see. I guess one of the questions on the very top here, do any of the health offer access to hormone specialists, functional medicine doctors, and integrative medicine doctors?
I'm not sure who you wanted to go first, but this is Adam from Blue Shield. And we do offer hormone specialists. Unfortunately, we don't have functional medicine doctors or integrative medical or medicine doctors. They're just not really willing to contract to come in network. But we do offer hormone specialists, yes.
Great. Thank you, Adam. If anyone else could touch on that with HealthNet Canopy Care or Kaiser.
Yeah, Jay. So for HealthNet Canopy Care, again, very similar. I always say this, like Adam just gives me all the answers too. But so yeah, very similar to Blue Shield. So we'll have that type of hormone therapy. Functional and integrative medicine doctors, as Adam said, typically do not take in health insurance coverage, but we do always recommend there is always some instances out there where there could be a provider that does operate as a functional integrative medicine doctor on the side and is also part possibly of a health system that is contracted with the plan. So we always recommend to check that provider's name through each respective health plan's provider search, just to rule out completely that they are in fact not covered. But if they are listed there as a health plan provider, then that would reflect that it's available for them.
Great. Thank you, Fred.
And for Kaiser, there are homeopathic doctors. There's not a lot of them, if that's what the question is asking, but there are some doctors within the Kaiser network.
Great. Thank you. Since a lot of the questions have already been answered earlier during the presentation, I'll read off a new one here on the very bottom. With Blue Shield HMO Access Plus, Note 1 in the benefits summary says that some outpatient prescription drugs are not subject to the pharmacy deductible, but all the outpatient prescription drug categories have a check mark saying the deductible applies, and there's not supposed to be a calendar year deductible. So for this HMO anyway, I guess Lucy just wanted to get clarity on that. I don't know if you caught all that, Adam.
For the HMO, I'm not really sure. I'm looking at the pharmacy summary right now, and there's nothing that indicates that those drugs apply to a deductible. I'm not sure. Note 1. Let me see. Note 1. Oh, that's okay. So it notes down there that benefit calendar year deductible outpatient drugs. It would be if the outpatient drugs are part of an outpatient service in the medical. So those would be subject to any kind of deductible, but on the HMO and the medical and drug, there is no deductible. So it's standardized language that's on the bottom of all the summaries. So there's no deductible that would apply there. On the PPO, there would be, but not on the Access Plus HMO or Trio HMO.
Thank you, Adam. Another question for you. What is the difference between the provider networks for Blue Shield PPO and HMO Access Plus? Are they identical networks?
They are not. PPO, if a doctor contracts on the PPO network, they're not within any kind of medical group. They contract independently. Whereas if they contract with the Access Plus or the Trio, they are contracted within a medical group. Brown and Tolan, Hill Physician, Chinese Community. So that's why you'll see that medical group on an HMO card and not on a PPO card. And not all PPO providers are contracted in the HMO and Trio, just like not all HMO and Trio providers are contracted in the PPO. So it's basically just how the provider wants to contract, but they are not identical.
Great, thank you for that. Let's see, I don't see any new ones coming in, so I'll read off previous question here. With Blue Shield HMO Access Plus, are routine lab tests covered because they are not diagnostic, like annual blood draws for A1C, cholesterol, thyroid, etc., which could be considered as preventive health services? I think the summary of the benefit says that only diagnostic labs tests are covered. And I think you've already answered this, but if you can reiterate that, please.
Yeah, preventive blood work is always covered at 100%, no charge, depending on how the doctor wants. If you have pre-existing conditions around diabetes or pre-diabetic, and they want to test A1C, all that would be covered. But even regular diagnostic labs are covered at a $0 copayment. So either way, they're covered. Yes.
Thank you.
And Jay, same
Again,
thing for
yeah,
HealthNet as
yeah,
well.
please, Fred.
Yeah, so same exact thing for HealthNet. So preventative lab work, radiology, that's covered at 100%. One thing I will add, there are some lab work that falls outside of that. One example that I'll use is sometimes, a member may go in, get the preventative, but something like a vitamin D lab test typically isn't something that falls under preventative, but it could be done as part of that preventative screening. So it's just something to be mindful of when members go in there, that the physician, at his discretion may actually request certain lab work that is not part of, let's say, that doesn't fall under the preventative classes under ACA. So again, just something to be aware of, but most providers will let the member know in advance that they're doing that.
All right, thank you so much, Fred. And a new one just came in. Again, this is for Blue Shield. I think it's a follow-up question from the previous question before. With Blue Shield Access Plus HMO, how do I know when getting a service if a provider that's in network is exceeding the allowed charges that can be covered, for example, reasonable and customary, so that I wind up having to pay out of pocket for the excessive charge? I think she's quoting something from note 4 on the summary of benefits.
Yeah, and I'm looking at note 4, and note 4 talks about calendar out-of-pocket max, so I'm not really sure where that's coming from. But on Access Plus, any provider you see, aside from your PCP, you should be referred to by your PCP, and they should be referring you within the same medical group. So allowed charges, customary, none of that pertains to HMO, because you're paying a flat dollar copay. So if, let's say, you were going to have surgery and you were in the hospital, it's $200 per admission. Doesn't matter if that hospital bill ends up being $1 million. It's $200. That's all you pay. There's nothing that would be added on to the end like excessive charges. So I'm not really sure where you're seeing it. Like I said, I'm looking at the summary, and note 4 talks about out-of-pocket maxes. It doesn't talk about excessive charges. So it sounds like you have a lot of questions around those type of things. If I were you, and I believe it's Lucy, I would go schedule an appointment with a one-on-one consultation. We opened up more appointments this morning. If you go out to the Blue Shield website or HSS, schedule an appointment to talk to a consultant about these types of questions, because I'm not seeing the note 4 you're referring to. So I want to make sure you're looking at the right documents.
Thank you, Adam, for the clarification. There's a new one that came in on the very bottom here. I guess this would be for Olga with HSS. Does the CCSF portal support dropping dependents? I only see a button to add a new dependent. Thank you.
Yes, so great question. So there are kind of two areas that are discussing dependents when you're going through e-benefits to add or drop your dependents. The very first screen when you go into the open enrollment workflow that asks you for your dependents is basically the history of anyone that you may have covered at one point. So what you'll see there is that you might have a dependent who is a child that's aged out. You may see a spouse that you may no longer be covering. So it's a list of anyone that you've either provided coverage for before or that you are currently providing coverage to. So it's just a list of your dependents that were eligible for coverage at one point. When you progress into the workflow and you go into each individual medical, dental, vision selections, that is where you're actually going to be dropping or adding the dependents that are going from that list that you saw on that very first page. So for example, if you are enrolling a dependent into your medical plan, you will be selecting the checkbox to be activated for that dependent for the medical plan that you select. If you'd like to drop a dependent, you would just unselect them under that category. And so you want to take that action under all three options for medical, dental, and vision. You're going to want to select or deselect the dependent, whether you want to provide them with coverage. If you are needing to add a new dependent that has never been covered before, that is where you're going to be taking that action on the first screen and adding their information into the system so that you have the opportunity when you actually get to the plan information to be able to add or drop that dependent from the plans that you're electing. Great question.
All right, that's a great question. Thank you, Olga, for that information. This question is from Canopy Care. Does Canopy Care HMO offers free headspace?
Hi, Jay. Yeah, great question. So Headspace, I believe that's unique to Blue Shield or Kaiser. The version of that mindfulness, stress, anxiety program or app that we use is called Unwinding through our shared care platform. So when a member enrolls with HealthNet, or if it's currently enrolled Canopy HealthNet members, they can access that program through through the share care platform. And actually, I will say that program Unwinding is also available to non-HealthNet members. So that's one of the only programs, it's one of the few programs that we offer where a member doesn't really need to be enrolled with HealthNet to be able to access that mindfulness anxiety program for free. And all that information can be found on our website, healthnet.com/SFHSS.
Great, thank you, Fred. Besides Brown and Tolan, what other medical groups contract with Blue Shield Access Plus?
Yeah, there are really too many for me to list out here. So my suggestion to that member was to either call customer service, the Shield concierge number, or to make a one-on-one appointment if there's a specific medical group they would like, because medical groups are determined where you live if you're in the service area. So we can't list them all out because you may not be eligible for all of them. But there are too many to list, but you would need to call to see specifically in your area based on your live and work rule, which medical groups are available to you.
Thank you, Adam. Again, this is an older question here in the chat box. Does Blue Shield consider the lipid panel for age of 30 years old a preventive lab work? Lipid panel for age 2.
I would assume that would be preventive. Yeah, if it's being ordered during your well woman or annual exam. I mean, it all depends on how it's ordered. But again, your preventive is free of charge and your regular diagnostic labs are at no cost. So either way, again, it's covered, whether it's covered under preventive or under your regular medical benefits.
Thank you. Does Trio HMO provide gym discounts?
We do offer for both Access Plus and Trio, we offer Fitness Your Way, which is with Divinity Health, and they are discount gyms where you pay a membership fee and then you join their network and you have access to all of their gyms nationwide. If you want additional information on that, you could go to blueshieldca.com/SFHSS, or you can call customer service. They'll have that information. But yeah, it's called Fitness Your Way.
Great, thank you. We only have maybe a couple more minutes left, and we can squeeze in any more questions. Again, if you have something in your mind, please type it in the chat box while we still have our representatives here.
Hey, Jay.
Yep.
I just because I've seen this on other questions. I just wanted to confirm. I think, sorry, another webinars I meant. So I know IVF or fertility services is a big question. So I think this is across all the health plans, but I'll just say that for the Canopy HMO plan, maybe the other representatives could just confirm, but it is 50% coverage, and that includes artificial insemination as well as give, zift, and IVF. Now there are certain limitations for each one of those more, you know, higher type of infertility services. So we always recommend that members check their EOC or they contact our customer service team.
Yes, no, thank you for that. That has come up, and that, yeah. Iris, if you could add on to that, I see you on the screen there. Yeah, thank you.
Yeah. And Freddie, yeah, thanks for that. Same thing for here. And Freddie was right. I think he also said that in one of the last webinars. I think that San Francisco's ideally they like to have it same across all their plans, structured the same across all the plans. 50% co-insurance for all of the services related to IVF and infertility benefits. And that's assisted reproductive technologies, including gift, zift, IVF, and that includes medications and inpatient, all the things that go along with it. And it does not, and you do need to look at your evidence of coverage for details. Very much you need to look at those. The documents are posted on sfhss.org. They have archives of documents. If you want to look at current year, look at upcoming year. So definitely look at those documents. And one note of importance, it does not apply currently to the out-of-pocket maximum. New legislation down the road may change that, but currently it does not.
Great, thank you, Iris, for that. Again, at this point, I want to thank all our representatives with Blue Shield, Health Net, Canopy Care, and Kaiser Permanente. Some of these questions I know are very difficult, but they're here to help everyone. Again, we highly encourage you to attend whatever webinars we have left this week. And, if you have tried to go in your HSS portal and you have not hit submit, we highly encourage you to do that because it's not going to reflect of the changes next year unless you hit that submit button. And with that, I think, hopefully a lot of your questions have been answered. And again, we highly encourage you to tell your colleagues about these webinars, whatever we have left, so they can make proper elections this year. And with that, I think we're going to wrap up this webinar. And thank you all, and everyone have a great day.
Thank you, Jay.
Thank you all.